Okay, we're going to go over some directional terminologies just to help you get used to the kind of the new language and the language that we use when we chart and when we describe locations on the body or how a part of the body might relate to another part. Okay, so the first two terms are going to be superior and inferior. Superior just means closer to the head, whereas inferior means farther away from the head or closer to the feet. Okay, so my eyes are superior to my nose. My fingertips are inferior to my wrist. Superior, closer to the head. Inferior, further away from the head. Proximal and distal. Now those sometimes can mean the same as superior and inferior. Proximal is going to mean closer to the trunk, whereas distal is going to be further away from the trunk. So when we're talking about proximal and distal, we usually are talking about something on the arms or the legs. Okay, I wouldn't use proximal or distal if I was talking about my trunk itself. Then I would use superior or inferior. Okay, so proximal means closer to my trunk. So my shoulder is the most proximal portion of my arm. Distal means further away, down towards the fingertips, further away from the trunk. So the most distal part of my upper extremity, my arm, would be my fingertips. Okay, so let's use our elbow. Our elbow is distal to the shoulder, it's further away, but the elbow is proximal to the wrist. Okay, and again, we're using these terms because if I wanted to describe, say my patient had a bruise right here, and in my chart I wanted to describe where their bruise was, I could say the bruise was half an inch or 1 centimeter proximal to the right cubital fossa, which is a fancy name for the crease of the elbow. But then immediately everyone would know exactly where that bruise was, okay, without having to take a picture or say, come on over and look at this bruise. Anterior and posterior. Anterior is going to be on the front of the body, and the posterior is the back side of the body. And we're always talking about our patient in anatomic position. Anatomic position is actually up on your toes with your palms facing forward. Okay, so the palm of my hand is the anterior surface of my hand, and then the back side of my hand is the posterior side of my hand. Okay, anterior front, posterior back. Medial and lateral. Okay, I want you to imagine that there is a line going straight down the middle of your body, and we actually call that the midline. That is a terrible marker. See if we have one that shows up. That's a little better. Okay, it's actually called the midline, the line down the middle of your body. Okay, medial means that something is very close or closer to that midline, and lateral means it's farther away. Okay, so if I was standing in anatomic position, okay, this is the medial side of my elbow because it is closer to my midline, and this is the lateral side of my elbow because it is farther away. Okay, the thumb is on the lateral side of my hand, and my pinky is on the medial side of my hand. Okay. Superficial and deep. I think you can kind of figure this one out. Superficial is closer to the body's surface, closer to the skin, and then deep is deep. It's further away from the surface. So my skin is very superficial, but my internal organs would be deep to my skin. My internal organs are deep to my muscles. My muscles are deep to my dermis and epidermis. Again, I think you got that one. Central and peripheral. this really comes into play when we're talking about one very specific area. And a lot of times when we're talking about a wound, so let's say we have a wound, and this is our wound right here, and we have some dead or necrotic tissue at the edge along the periphery. We would say the necrotic tissue was peripheral. If we had some necrotic tissue right in the center, we would say it was central. So anything around the edge of whatever we're describing would be peripheral. Anything in the center of the area we're describing, we would call it central. And then the last two terms are ipsilateral and contralateral. Contra means opposite. If I was being contrary, I would be arguing with you. I would be expressing the opposite opinion that you are. Contra, opposite. So, and lateral means side. So contralateral means opposite side. Ipsa means same. Ipsilateral means same side. So for example, if I was in a terrible car accident and I broke my right arm and my right leg, I have ipsilateral injuries. I have injuries on the same side of my body. I heal from that, but gosh darn it, I have terrible luck and I'm in another car accident, and this time I break my right wrist and my left ankle. I'm not sure how I did that, but let's say I did it. Now I have contralateral injuries, okay, two different sides of my body. Okay, those are all your directional terms.